Hello friends, I'm Dr. Jatin from Mumbai Eye Care. I'm an ophthalmologist. Today we'll be discussing about how to protect and take care of your eyesight. What is it that makes eye and vision as the most important thing? Eyes are windows to our soul. Most of our learning and memories are because of what we see, and they form the most important sense organ that we have in our body. The World Sight Day is basically an annual global event which draws attention on blindness and visual impairment. Our objective is to create awareness about eye care, visual blindness, and treatment that can be involved in curing eye impairments. This day is focused on drawing attention to leading causes of blindness or visual impairments like cataract, glaucoma, refractive errors, and other eye diseases. What we know is that globally, there are 12.2 billion people who have an unaddressed vision impairment or blindness. Amongst these, 1 billion people have visual impairment which could be avoided and yet is to be addressed. And most importantly, 1.1 million people in India are blind because of corneal blindness. And more than 1 lakh corneas are required annually for cornea transplantation. But at the moment, the transplantation number is only 25,000. So what we need is more donor corneas. So what actually happens when we are looking at things and how do we actually see things? So sight is basically a physical phenomenon wherein the sensory experience on which the light falls, it then gets reflected onto the eye, and these signals are then transmitted to our brain, which forms the final image of the object. So it is basically forming an image onto our brain, and that's how we start seeing things. So we will try to basically understand what the eye anatomy is. So eye is a complex structure which is similar to a camera. The front part of the eye is called the cornea, which is a transparent structure, and this is protected by the eyelids and the tear film. Behind this is a small opening called the pupil, which is formed by the iris tissue, behind which is the crystalline lens, which is normally transparent when we are young and starts to get opacified as we age. Behind which is a jelly-like structure, which we call the vitreous hemorrhage, which protects the retina, which is the main seeing part of your eye, and your optic nerve, which connects the eye to your brain. So what are the common eye problems that we face and commonly see? The commonest ones are refractive errors or eyeglasses numbers, which may be a minus number or myopia, a plus number or hypermetropia, or cylindrical power, or which is also called astigmatism. Dry eyes, digital eye strain, allergic eye diseases, color blindness, and night blindness. In children, there are other diseases in form of lazy eyes, squinting of eyes, and drooping of the eyelid, which is called ptosis. In elderly population, common problems are near vision issues, which we call presbyopia, cataract or motiabindu, glaucoma or kala motiabindu, age-related macular degeneration or retinal degeneration, and diabetic retinopathy. So basically, what is it that makes us need glasses? So whenever our eye is longer than a normal person, we require to wear minus power glasses. This is what we call myopia or nearsightedness. Similarly, when the eye is smaller than the usual size, then we require plus power glasses, which is what we call hypermetropia or hyperopia or farsightedness. Whenever there is a difference of the power between the two eyes, or one eye is working less than the other eye, we call the less working eye as a lazy eye or amblyopia. This condition needs to be diagnosed early, and it requires proper spectacle correction. Along with that, you may require to patch the better eye and force the lazy eye to see. And the early diagnosis and early treatment can help us restore vision, else it can lead to permanent vision loss also. Whenever the light rays fall in different directions in the eye, This is what we call astigmatism, or cylindrical power is required to correct that. Squinting with the eye or strabismus is a condition wherein the eyes are not aligned properly, and this would require correction with glasses, exercises, or surgery. This is not just a cosmetic problem, but also requires treatment in order to restore eyesight and to restore binocularity in order to have a perfect depth of vision. Ptosis or droopy eyelids are a common condition usually seen in children, and sometimes they may be there right from birth and may increase with age. It can also happen because of aging in elderly population or because of some trauma. This condition requires surgical correction and is required to be done in early childhood in order to prevent formation of lazy eye. Corneal ulcers are infective conditions wherein the front part of the eye, which is a cornea, gets infected with some organism, which can be because of an injury or some other systemic factors such as diabetes or low immunity leading to infection in the eye. The common symptoms being redness, irritation, foreign body sensation, pus or thick discharge, swelling of the eyes, and a white spot on the cornea. The commonest infections are because of bacteria, viruses, fungus, or parasite. This is a serious condition and requires immediate treatment by an ophthalmologist with extensive use of topical drops. And sometimes, when the medications don't work, you may require to undergo a cornea transplantation. Conjunctivitis or pink eye is another very common condition wherein the blood vessels of the eye get inflamed and become more visible. This can be because of bacterial infection or viral infection, or even because of allergic eye condition. This includes symptoms of redness, itching, grittiness, foreign body sensation, and tearing. The commonest causes are bacterial or viral infection, and the treatment includes artificial tears, antibiotics, and to decrease allergy, you may require anti-allergic medications. Cataract are the commonest aging process wherein there is cloudiness that develops in the clear lens of the eye, and this leads to decrease in the vision, fogginess of vision, and problems with night vision and glare. The treatment is simple surgery, which is called phacoemulsification, or this can be done using femtosecond laser, wherein the doctor makes a small incision on the corner of the eye, and using a special machine, the cataract is removed and an artificial lens is implanted in the eye. Another common condition is glaucoma or kala motia bindu, which is because of the eye pressure that builds in. This condition leads to narrowness of the visual field, and your ultimately fields become like a tunnel vision. This is a silent thief of the vision and requires lifelong treatment with drops. This condition should not be ignored and has to be treated on time. An early diagnosis can prevent irreversible vision loss in patients who are diagnosed with glaucoma. Glaucoma requires lifelong treatment with drops or laser therapy or surgical intervention in form of drainage tubes or minimally invasive glaucoma surgery. Another important condition is age-related macular degeneration, which is an aging process wherein the retinal vessels or the retinal layers give away, and there can be development of new vessels which can bleed within the eye, leading to permanent vision loss. This condition requires treatment with injections and regular monitoring in order to prevent permanent vision loss. Another important condition is diabetic associated visual loss or diabetic retinopathy. This condition is commonly seen in patients who have long-standing diabetes. Basically, diabetes affects the blood vessels within the retina, which start to leak the blood within its layer, and you start having patchy vision loss. And sometimes, if the blood loss is more, it can lead to complete loss of vision, which requires surgical intervention. So, keeping your blood sugar under control is paramount in order to prevent diabetic retinopathy and to have a very common problem to be avoided. A regular eye examination is again paramount to prevent blindness because of diabetic retinopathy. Another common problem that people face because of screen use is eye strain. In this condition, people most commonly have symptoms of tiredness, dryness, strain in the eyes, which happens at the end of the day and leads to blurriness of vision, eye irritation, stinging or burning sensation, redness, headache, feeling of disorientation, watery eyes, and difficulty in focus. All these combined form what we call digital eye strain syndrome or computer vision syndrome, which is increased these days because of increased use of digital devices during the COVID-19 lockdown. The treatment is quite simple. Would require to use proper digital media, a proper seating, and keeping a proper angle of your screen when you are using your screen, a proper technique of using appropriate brightness of your screen. Follow a 20-20-20 rule wherein you have to keep looking at a 20 feet object for 20 seconds every 20 minutes. Wash your eyes and lubricate them regularly. Keep blinking more often. Hydrate yourself very regularly so that you decrease the chances of dryness of your eye and digital eye strain. It's very important to have a regular eye examination for everyone, right from as early age group of 3 to 5 years. A comprehensive eye checkup is important for everyone, and a yearly eye checkup is advised for all of us in order to pick up any eye related problems early and treat them on time. Most importantly, it is also important that we all understand the ultimate truth of life, which is death. And after we are gone, that we pass on our eyes to somebody else. Let us pledge together, donate our eyes, light up somebody's life, and help some visually impaired person to see the beauty of life. Thank you very much.